You are welcome to my channel. Today I'll be talking about stroke subtypes. Please check my channel for ischemic stroke syndrome and causes of stroke, treatment of stroke, all already published right here, including lacunar stroke. Okay, the ischemic stroke. Ischemic stroke is about 80 to 85% of all stroke, and ischemic stroke could either be embolic or thrombotic. Let me quickly go through risk factors associated with ischemic stroke. Diabetes mellitus, hypertension, transient ischemic attack, sickle cell disease, atrial fibrillation, venous thromboembolism, that is PVT or pulmonary embolism, infective endocarditis, combined oral contraceptives, hormone replacement therapy, valvular heart disease, increased low-density lipoprotein, autoimmune diseases, and smoking. Others will include street drugs, family history, pregnancy, obesity, male gender, diet, age, and COVID-19. Now, the embolic ischemic stroke. These will have sudden onset. The maximum deficit will occur at onset. There may be improvement, and that could happen very quickly. But classically, the patient might give us the history of trying to urinate at night. So they'll say, I got up from bed and then trying to pee, then the whole thing started. Also, there could be history of coughing or sneezing before the onset of the stroke. The thrombotic is, however, different from the embolic because it's not going to be as sudden as embolic, so slowly evolving symptoms. Not so sudden like embolic. There may be carotid bruit if you auscultate, so don't massage that neck in thrombotic ischemic stroke. Improvement in symptoms is sporadic, not so classical as it will be found in embolic. Large arteries involvement may take longer time to be fully formed. Lacunes will be formed over hours or days. Now the hemorrhagic stroke. Hemorrhagic stroke will constitute about 15 to 20% of all strokes and is either intracerebral hemorrhage or subarachnoid hemorrhage. The risk factors associated with hemorrhagic stroke will be age, family history, race, that is blacks or Asians more than whites, the type of diet, and pregnancy. Other risk factors will be aneurysmal bleed, arterio-venous malformation, smoking, hypertension, adult polycystic kidney disease, Marfan syndrome, Ehlers-Danlos syndrome. So from smoking to Ehlers-Danlos syndrome is having pneumonia called SHIP. Other associated risk factors will be bleeding dyscrasia, street drugs like cocaine or amphetamines, anticoagulants, thrombolytic agents, trauma, or stress. Associated risk factors with hemorrhagic stroke will also include obesity, cerebral amyloid angiopathy, alcohol, cocaine, or heart disease. Now, subarachnoid hemorrhage. Subarachnoid hemorrhage will have sudden onset associated with a severe headache. As a matter of fact, the individual would describe the headache as the worst headache of his or her life. Focal signs, that is regional neurodeficits, are less common here. There might be reduced alertness precipitated by increased activity like seeing what I've written here, right, and other physical exertion. Now, intracerebral hemorrhage. The onset is sudden in some cases and might be gradual. May be precipitated by stress or secondary to severe exertion. The maximum deficit could occur at onset and gradually progressing in many other cases. It may progress in minutes or hours. Intracerebral hemorrhage could lead to decreased level of consciousness, coma, and death. And with that, I've come to the end of this representation as per stroke subtypes, hemorrhagic or ischemic. Thanks for listening. Remember to check my channel for ischemic stroke syndrome, talking about territory of arteries and how they're going to present differently, and lacunar stroke, symptoms, causes, prevention, and treatment, all published right there. I appreciate it. Share with your friends and remember to subscribe. Thank you.